struggling with stubborn fat that won't budge, blood sugar spikes, insulin resistant, or prediabetes, and you're tired of not seeing much progress, this is for you because today we are chatting about habits. Hi, I'm Ryan. I'm a keto coach and certified advocate through the Metabolic Terrain Institute of Health. I am passionate about helping men and women suffering from metabolic issues reclaim their health and vitality through lifestyle changes. So I've embraced the fact that habits are the foundation of better health. Once you start stacking little wins, habits that support your body without having to really think about them, you're setting yourself up for real lasting change. Today, I'm gonna share with you 3 simple but powerful habits that you can start doing today to naturally lower your blood sugar and ultimately see results on your waistline. So these are things that have worked personally for me, and they are backed by research. They're easy to do, real changes that you can make. So habit number 1, I want you to pay attention to when and how you eat. So let's start with something called chrononutrition. Yeah, it sounds super sciencey, but stick with me because this is actually quite fascinating. So chrononutrition is the idea that our metabolism follows a natural 24-hour clock, kind of like our sleep cycle. And when you eat actually affects how the body processes food. So studies from the NIH and Nature Reviews Endocrinology show that we are more insulin sensitive in the morning and early afternoon than at night. So this means that your body handles sugar better in the earlier part of the day. So when we eat late at night, especially big meals or snacks close to bedtime, our blood sugar tends to spike higher and stay high longer. It also messes with our sleep. So one of the best things that you can do is front load your meals, which means eating a bigger breakfast and lunch and having a lighter dinner, ideally finishing your last meal 2 to 3 hours before bed. I've been working to move my dinner up earlier in the evening, which isn't always easy to do, but it's undeniable that when I do, I notice that my sleep is better and my fasting blood sugar trends downward. So if you pair that with solid meal composition, meaning that you're gonna prioritize protein, fiber, and healthy fats, you're gonna give your body exactly what it needs and at a time that it can actually handle it. So the second habit that I want you to incorporate is to move after meals. So I've been speaking about this a lot recently because it has been such a game changer. And it's even better because there's so much research to support it. So there was a crossover study published in the International Journal of Health and Clinical Research. And that looked at 2 groups of people with type 2 diabetes. One group did a 30-minute walk once a day in the morning. The second group did a 10-minute walk after each of their meals. So after 15 days, both groups had improvements in their blood sugar, but the group who walked after their meals had a 10 to 12% greater reduction in their fasting blood glucose compared to the ones that just walked in the mornings. So both groups had the same amount of total walking time, right, 30 minutes, but just different results. And that's because our muscles act like a sponge after we eat, right? After we move, especially after the first 30 to 60 minutes after you have a meal, your muscles will help to absorb that glucose from your bloodstream without needing as much insulin. So even if you can't do a full workout, just 10 to 15 minutes of walking right after eating, or you could do light housework or dance around in your kitchen or play with your dog. All of this is going to help, and it's much better than just eating and sitting still. So this is something that I recommend. I have personally been putting it into practice, and it is one of the easiest and most effective habits that you can start. So habit number 3 is to improve your sleep and manage your stress. So you could be doing your diet perfectly. You could be meal prepping every week, walking after all your meals. But if your sleep is trash and you are chronically stressed out, your blood sugar is going to reflect that. So if you don't follow Dr. Ben Bikman, I recommend that you do. He is a metabolic scientist that talks a lot about how stress hormones like cortisol compete with insulin. So when your cortisol is up, your blood sugar goes up, and then your insulin becomes less effective. And one of the biggest contributors to elevated cortisol is a lack of sleep. So there was a study that I'll link below that found that just 5 nights of sleeping only 5 hours a night caused a 20 to 25% reduction in insulin sensitivity in healthy men. So that means that they became temporarily insulin resistant in just a few days. Their cortisol and their adrenaline were elevated, and their bodies just weren't able to handle the glucose in the same way as they would if they had better sleep. And I love how Dr. Andrew Huberman explains this. He says that poor sleep is a stressor, and that managing stress is about giving your nervous system the tools it needs to calm down. So here are 4 tools that you can use to help with stress and sleep. So the first is breath work, and Huberman calls this technique the physiological sigh. So you want to take 2 quick inhales through the nose, followed by 1 long exhale through the mouth. And you repeat that a few times, and you'll feel your heart rate start to drop. It is the fastest way to calm your nervous system. So next is smart supplementation. If you're having trouble sleeping because of racing thoughts, you can try L-theanine, about 100 to 200 milligrams before bed, and that is gonna help calm your mind, and it can support deeper sleep. So you can also try a magnesium citrate or malate. Those are great options to take before bed because magnesium plays a crucial role in relaxation and deeper sleep. And personally, I notice that I fall asleep faster and sleep more soundly when I am consistent with my magnesium. So another supplement that you can take is ashwagandha. It's an adaptogen that has been shown to lower cortisol during stressful times. So I wouldn't use it every day, but it is helpful when life gets a little loud. You can take it before bed or during the day to kind of soothe any anxiety. The 4th tip here would be to stop eating 2 to 3 hours before bed. So this kind of ties back to habit number 1, right? Going to bed with a full stomach is going to disrupt your sleep, and it's going to keep your cortisol elevated. So a light dinner makes you sleep deeper, and it will make your morning glucose lower. So let's recap this. So you want to eat with your body's clock and stop eating close to bedtime. You want to move after each meal to keep your blood sugar from spiking. And you want to sleep well and calm your stress with breathing, some supplementation, and some nervous system care. So these are not extreme habits, but they are simple and totally doable in real life. So let me know in the comments, which one of these do you think that you can focus on this week? If you want more metabolic tips, meal ideas, and support, please hit that subscribe button. And if you haven't yet, check out my guide and journal, Metabolic Mastery. I have it linked in the description. It is packed with simple, practical steps that you can use to get started on your path to better health. So you don't have to be perfect. You just have to start. I'll see you in the next one, friend. Bye.